An American doctor working in Democratic Republic of the Congo has tested positive for Ebola as a fast-spreading strain pushes Central Africa into a health emergency. According to U.S. Centers for Disease Control and Prevention, the infected U.S. citizen developed symptoms over the weekend and tested positive on Sunday. U.S. officials said the patient is being evacuated to Germany for treatment, along with 6 high-risk contacts. President Donald Trump also expressed his concern.
I'm concerned about everything, but certainly am. I think that, it's been confined right now to Africa, but it's something that has had a breakout.
More than 100 deaths and hundreds of suspected cases have already been recorded. The World Health Organization has declared the outbreak a global public health emergency after confirmed cases spread from eastern Congo into neighboring Uganda.
The Ebola outbreak in the Democratic Republic of the Congo and Uganda constitutes a public health emergency of international concern, highlighting the high risk of further spread and the likelihood that the outbreak may be larger than currently detected. The outbreak involves the W.H.O strain of the Ebola virus, for which there are currently no licensed vaccines or specific therapeutics.
Meanwhile, Washington has responded with tighter airport screening, temporary visa suspensions, and entry restrictions for travelers who recently visited Congo, Uganda, or South Sudan. After infections were confirmed in travelers arriving from Congo, Ugandan authorities also pushed aggressive contact tracing and border screening, while major public gatherings have been postponed.
There's a lot of screening happening at the border because trade has to go on and people need to continue with their lives. But there is a lot of screening happening at the moment. So everybody crossing the border from the other side is being screened.
The W.H.O strain has only been detected twice before, in Uganda in 2007 and Congo in 2012. Experts warn that this could become one of the largest outbreaks ever recorded involving this rare variant, especially as steep aid cuts and reduced international coordination strain the response effort. For more on this story, our correspondent Louisa has sent us this report from Lagos, Nigeria. Take a look.
All efforts are being put in place to contain the Ebola outbreak from becoming a pandemic as the WHO appeals for funds. The UN organization says it has airlifted over 5 tons of essential medical supplies, including personal protective equipment and diagnostic kits, and the deployment of medical staff. United States also had, on the 14th of May, announced $1.8 billion funding support to the United Nations Office for the Coordination of Humanitarian Affairs, with $250 million of it meant for Ebola in DRC and Uganda. We recall previous outbreaks in the DRC killed thousands and triggered large-scale international emergency operations as the world raced to contain the latest strain. From Lagos, Nigeria, Louisa Olaniyi, WION World is One.